Hi there, my name is Sue Turner. I'm here doing my video OSCE for migraines for paramedic primary healthcare. I'm here with Mel. Hi Mel.
Hi.
So we've been called to Mel today because she's been experiencing some headaches and we're here to find out a little bit more detail why. So tell me Mel, what's been going on today?
I've just had my normal migraine pain, just right there. Yeah, it's just I'm not too sure what to do next, really.
Okay, so you've had these type of symptoms before?
A couple times.
Yeah. Okay. Have you seen your doctor for them previously?
Yeah. I think he gave me some medication or something. I don't really remember, to be honest.
Okay, do you know what medication that was?
Nah, I wouldn't be able to tell you.
Okay. And have you taken any medication for this at the moment?
No, not yet.
Okay. So when did all this start for you?
Started late midnight, so last night. Just pretty uncomfortable. Hadn't really been able to sleep too well.
Yeah. And is the pain constantly there, or does it change?
Yeah, it's constantly there, but it worsens every hour or so, I guess.
Okay. Yeah. And is there anything that makes it worse for you?
So if I was to stare at these lights right now, it's really uncomfortable. But I suppose just being awake just sucks.
Yeah. And what is it makes it better?
Just when I rest. Yeah.
Okay. Do you sit in dark room or anything like that?
Yeah, definitely. Yeah.
Okay.
That's when I'm much comfortable.
Yeah. Great. So tell me, what exactly does this pain feel like?
It's just it's really sore just right there. Yeah.
It doesn't radiate anywhere else?
No, I don't know.
Okay, so just behind this eye and sort of around on this side?
Yeah.
Okay. And how's your vision at the moment? Can you see me clearly with both eyes?
Yeah, a little bit.
So if you
shuttery.
just close one, you see me okay there?
Yeah.
And the other side?
Yeah.
Exactly. I'd just like to check your pupils if that's okay.
Okay, sure.
So I'm just going to check the pupil size and response. Yeah. So they both look really good. Wonderful, thank you very much for that. Okay, have you got any other symptoms with this at all?
Felt a little bit nauseous before, but it's passed.
Yeah, no nausea at all now?
No.
You haven't actually vomited?
No.
Okay. Have you got any pain in your neck?
No.
Any pain in your jaw?
No.
Okay. Do you mind if I just do a couple of little checks as well while we're doing this? I'd like to do a set of vital signs on you. And I'd also just like to check your temple if that's okay. So I'm just going to touch that now if that's all right.
Yeah, okay, sure.
So I'm just going to touch here. And when I press here, is there any pain there?
No, it's fine.
No? Okay, just checking for temporal arteritis there. Okay, so I'd like to do a full set of vitals. So that means checking your blood pressure,
Okay.
and your pulse, and your temperature. You haven't taken any painkillers for this today, no?
No, don't really have any paracetamol in the house. So.
Okay. Have you got any allergies to any medication?
No.
No? Okay, so your blood pressure's perfect at the moment. It's 120 on 80. And just check your pulse as well. That's nice and regular, nice and strong. And a heart rate of 66, so that's perfect. And I'd just like to check your temperature as well. You haven't had any cough or cold symptoms recently?
No.
No? Perfect, so that's your temperature of 36.6, which is wonderful. So we've got no issues with those at all. Okay, so I'm just going through a few ways of remembering different symptoms and how things are with migraines. So I'm looking at the British Association for the Study of Headaches. So that's sort of, in my head, I'm just going through how many different types of headaches you experience, and you're just saying it's the one side.
Yeah, just right here, yeah.
Yeah, and it kind of, when it comes on, you were lying down in bed,
Yeah.
and it kind of gets a bit worse and then gets a bit better. Yeah, okay.
Yeah.
It's quite intense just on that one side, not radiating anywhere. Are there any activities you can't do when you get a migraine?
No, it kind of just puts me to bed for a few days. Yeah.
Okay, fair enough. And between your attacks of migraines, have you been well normally?
Yeah.
Yeah, no issues with that at all?
No.
Fantastic, all right. So your sight's good, you're able to move okay around your mouth, or all good. Stick your tongue out for me. Yeah, that all feels okay. No issues, no issues swallowing?
No.
Okay, and no neck stiffness.
No.
No changes in your taste either?
No.
All right, just a couple of other little tests I'd like to do. Something called the Koenig sign.
Okay.
So what I'd like to do, from that seated position with your leg at 90 degrees, I'd just like you to raise your leg up and straight. Now, does that make any symptoms worse?
No.
No, that feels okay, good. So that's just testing for any subarachnoid or meningitis type symptoms,
Okay.
which we haven't got, so that's really good.
Good.
Now, Grodunski sign as well
Yeah.
is the other thing I'd like to check for. So with your legs like that, if you could just bring your neck down. Okay, does that increase any pain anywhere?
No.
Perfect, all right, so we've got negative for that. And nuchal rigidity, so you haven't got any impaired neck movement at all, no muscle spasms in your neck, so that's negative there too. Fantastic, okay, so with this then I'd like to just go through some red flags that we need to check just to see if there's anything else going on. But before I do that, I'd give you some medication just to help with that pain.
Okay.
So you've got no allergies for any medications, and you haven't taken any paracetamol or ibuprofen in the last 4 hours. Okay, right, I'd like to get these out now. So what I have here is paracetamol and ibuprofen. So I've got ibuprofen, which are 200 milligram tablets, of which I'd like to give you 2 of, which is 400 milligrams, being that you're under 80 kilos. And we've got an expiry date on there of 8/20/20. And we've got paracetamol, 500 milligrams. I give you 1,000 milligrams of that. And that's expiry of 11/20/22. And I'll just show my offsider who's over here and say, can you just check those for me? Can you just say that it's, as I said, is that correct?
That is correct.
Perfect, thank you so much. So that's just checking my drugs here. But we'll just take out a couple of those. I'll shove them in your hand so I don't get them on my hand at all. There we go. Just take those. Do you want some water or are you quite happy? Fantastic, okay. So ibuprofen and paracetamol given. Okay, so just now the red flags now, because we're looking that it is your migraine, normal migraine type symptoms.
Feel like my normal migraine.
All right, let me just check on my CPGs for any other things I might have missed for headaches. Okay, so red flags we're looking at here. So headache or neck pain following neck manipulation. You haven't had any massages or anything like that recently. No neck pain or neck stiffness, no sudden onset of severe headache. Temperature is less than 37.5. No persistent vomiting, no focal neurological signs, no altered levels of consciousness. No worsening headache following a recent trauma to the head. You've had no recent trauma. You're not taking any other medications, so no anticoagulants or a known bleeding disorder. No signs of temporal arteritis, I checked that. Any chance you might be pregnant? No, we're not hypertensive anyway. No previous history of intracranial bleeding. No family history of cerebral vascular abnormalities. And this wasn't onset during any sexual activity. Okay, so that's just checked through all of those. So I'm quite happy that this is your normal migraine symptoms. I would recommend that you do see your GP though, because you seem to be getting these more regularly.
Okay.
And your GP can prescribe other medications specifically for migraines. For example, sumatriptan is a really good medication for migraines because it actually reverses the dilation of the blood vessels in the head. So that's a really good medication for you to look at. I have got an information sheet here that I've put together for migraines. Now this information sheet will give you an idea of a little bit about what migraine is and how it works. I would recommend you keep a migraine diary, which will be good for your doctor to see exactly when these symptoms start coming on, and detail in there when they started, how often it is, what type of pain it is, any other symptoms, how long they last, and it's all written down here for you to have a read through anyway. By that you'll learn what your triggers are. So anxiety or stress can really trigger these things. If you had too much alcohol, that can trigger migraines as well. Any changes in your sleep patterns, strong smells, loud noise, bright or flickering lights can also trigger them as well. But the things that you can do to help, lie in a quiet, cold, dark room, avoid too much movement, and as you say that also helps you anyway. Apply a cold flannel to your neck and forehead, avoiding caffeine, avoid screens like monitors and phones and things like that, and get plenty of sleep. So when to call us back on 111, if you've got a sudden onset of severe, like explosive headache, give us a call back straight away. If you've got persistent and uncontrollable vomiting, any onset of migraine during sexual activity, or if the migraine is different to your normal type, if you're feeling scared, frightened about what your current symptoms are, please call us back.
Okay.
Alternatively, see your GP. As I say, I think you should do that anyway and talk to him about migraine medication and ways for you to cope with this. See your GP tomorrow and give Healthline a call if you've got any other issues, any queries that you want answering for any further advice. Is that okay?
Yeah.
All right, I'll leave that one with you.
Cheers.
Thank you very much.